Oklahoma's already poor health rankings have fallen even farther. A recent national health report shows Oklahoma experienced the biggest drop in the nation and is hovering near the bottom of all states. While behavioral issues were a major factor, the study shows the biggest driver is the decline of access to health care.
The United Health Foundation now ranks Oklahoma 47th in the nation for overall health, down from 43rd the previous year. State Department of Health Interim Commissioner Tom Bates says the findings, while disappointing, are not really surprising.
We know we have an issue with diabetes in this state, and we know we have an issue with obesity and poor cardiovascular health, which was where, that were really reflected in these rankings.
Among the areas of concern listed by the report were smoking rates, which increased slightly last year to 20.1%, and obesity, which climbed to 36.5%. But the biggest factor cited by the study was a lack of health insurance, with the number of uninsured Oklahomans rising to 14%, second only behind Texas.
Most of the people that I talk to in this role, and that includes hospital executives, doctors, physicians, health insurance matters, and matters greatly. The question then becomes, from a policy standpoint, is how do you accomplish that?
Carly Putnam, policy analyst with the Oklahoma Policy Institute, believes poverty and the lack of health insurance is a major factor driving the poor rankings.
When someone doesn't have access to care starting early, if they're working in jobs where they don't have a lot of control over when they're going to be home, when they can cook, if they have enough money for the healthy food that we know they need, and then if they don't have access to care, that sort of creates a perfect storm for some really poor health outcomes.
And she says the state's decision not to expand Medicaid has contributed to the lack of health care access.
Oklahoma is struggling in this regard because of policy choices that the state has made. And those are choices that can be undone. We don't have to do this. We can do better.
Oklahoma is one of only 14 states that refuse to accept federal money under the Affordable Care Act to expand Medicaid, which could have provided health coverage to an additional 200,000 Oklahomans. House Minority Leader Emily Virgin says Medicaid expansion will be among Democrats' priorities during the upcoming legislative session.
We know that it's good policy. It's just getting people to see that it's also good politics. And unfortunately, they're letting politics get in the way of good decision making and good policy and what's best for Oklahoma.
The federal government offers a 9-to-1 match to expand Medicaid. So a $100 million expenditure by Oklahoma would bring an additional $900 million federal dollars to the state. Virgin believes the latest revenue estimates give Oklahoma a golden opportunity to take advantage of the deal.
Before we didn't have the money to do this match, to put up the money that the feds want to see in order to provide theirs. So we feel with a budget surplus this year, we can do that.
But that's likely to be a tough sell for Republicans, including Governor-elect Kevin Stitt.
I'm not for Medicaid expansion. I am for looking at every federal dollar I can.
Virgin says her caucus would like to begin negotiations next session to discuss the issue.
But if our counterparts in the House and the Senate and at the governor's mansion don't want to do this, then we will take it to the people. We can get it on the ballot, and we feel very confident that if we did that the people would vote in favor of it.
Putnam believes an initiative petition for a state question to put Medicaid expansion on the ballot would stand a good chance of success.
We saw Medicaid expansion pass at the ballot box in Utah, Nebraska, and in Idaho this year. And we know that Virginia's legislature managed to pass it earlier this year. So whether it's legislative or whether it's at the ballot, we know that this is something people want and something they need.
Meanwhile, even more Oklahomans could lose their health coverage if a proposal to add work requirements to Medicaid eligibility is implemented. Putnam says a waiver that would allow the state to customize its program to require non-disabled adults to work, study, or volunteer 20 hours a week to qualify for Medicaid would make a bad situation worse.
What we've seen in Arkansas, for instance, which I believe has now had thousands of people pushed off their health coverage, most people are either working or would qualify for an exemption. It's that they're getting tangled up in the red tape and they're falling through the cracks as a result.
The Healthcare Authority formally submitted the proposed waiver earlier this month. If approved, it would make Oklahoma the only state to adopt a work requirement without expanding Medicaid or raising the income threshold to qualify for the program.